participation. We want to get everybody in the public, including private citizens, families, individuals, and businesses, corporations, to understand the impacts of pandemic flu, that it's not a 2 or 3 day deal. It's 2 or 3 weeks, possibly 2 or 3 months, where there's no food available because everybody's sick, there's no transportation, there's no gas, there's no money. You really got to be prepared for that.
Every operation.
And it affects businesses immensely. They have to have HR policies set. They have for sick time. They have to have ideas of where they're going to get their raw materials if they're a manufacturer because of supply chain disruptions. So we wanted to get the word out. That's really what community preparedness and participation is about. Additionally, there's some more grant requirements from ASPR, which is the Assistant Secretary of Preparedness and Response, and Denise O'Farrell runs that grant program at the Health District, and she gets a whole nother list of things we have to do that are very much coordinated with the CDC grant requirements. But the ASPR side of it works more with the hospitals, and this is what she had to deal with. It was interoperable communications. Again, that's using radios to talk. Bed tracking. There's new software out from the Idaho Department of Health and Welfare about how to track the beds and their availability on the internet. So we wanted to test that out, and it actually worked out fairly well. Mm-hmm. Hospital evacuation. If you go back to Katrina again, a lot of all this stuff is based on some of the lessons learned from Hurricane Katrina. And they found that hospital evacuations were very, very difficult. So we actually completed one of those in April in Caribou County at the Caribou Memorial Hospital. And we were going to do it again in July. And ESAR VIP is a emergency early registration of volunteer health professionals. That's another new piece of software where we can pre-register doctors, nurses, and get all their credentials together so that they can just walk in.
When they come on site, they're registered and they're credentialed.
They're ready to go. Another after-action item from Hurricane Katrina. Mm-hmm. That system was not available yet, fully fielded, so we didn't use that one. Fatality management is almost the same exact thing as what it was from the target capabilities of the Homeland Security. How do you manage these mass fatalities that are happening? And the result was actually good, and I'll get to that in a bit. Ventilators, ancillary supply, and oxygen is also, where do you get these items? Ventilators are not in high supply in southeast Idaho because they cost a lot of money, and not only that, but you have to have technically trained people. So southeast Idaho already has some access issues with good health care, and this is one of the things. But the idea we wanted to do is kind of figure out where some of these supplies would come from. PPE and infection control is personal protective equipment. How do you protect the first responders from getting the flu when they're dealing with people who have the flu and it's highly contagious?
Those are the ones you want to keep healthy.
You got to keep those healthy because they have technical skills that not everybody else does. Alternate care site we already talked about. That's where we want people to go that are sick with the flu. Then mortuary service and supplies is tied back into fatality management also. And we had an exercise on July 17th for that. So when we set up the alternate site, there's 4 really basic goals. This was not a big full-scale exercise, if you remember what we did in June of 2006 with the pods. Really all we wanted to do was set up the equipment that was available. We do not have large caches of equipment with 50 cots and 10 days worth of food for 500 people. So a lot of these things don't get involved with the exercise. We took we have small caches of equipment in the hospitals, and we grabbed those. There were cots, blankets, some masks and gloves maybe, and just exercised how much time and how many trucks it takes to move them to the alternate care site. So after that, we determined a complete incident command system organizational chart. Incident command system is really who's in charge and doing what. So you got an incident commander or a site commander, the logistics person, the operations, the admin and finance, and we just pre-name out who's going to do those. Then we do a walkthrough of the alternate care site, such as if you were a patient, and this helps you determine some of the different problems that you might run into. If I'm a patient, where do I park? And if I'm parked somewhere, how do I walk into the building? Really simple questions, but if you don't think it through from that standpoint, there's problems. Because if you're expecting 200 cars and you only got parking for 50, that's a problem already, and people aren't even in the door. Where do they keep their personal effects? How do they register? What forms are they registering with? You just take it through each step by step, such that if they got a bag, where do they put their bag while they're in the alternate care site? How is it secure if they got personal belongings in there that are high dollar and highly pilferable? How do they get out of there? You know, what's the checkout process while they're there? Where do they eat? What do they eat? And who's cooking it? Who's cleaning the area? And do they have to clean their own areas? Bathrooms, all kinds of facility questions go into that. And then finally, how do they get out to their car? Or, unfortunately, you also have to think about that they die in a pandemic flu situation while they're there.
Which
how do they
will happen.
Get picked up? And it's a morbid thought, but you got to think that through. And then finally, really simple is making a floor plan so that we can put it into the plans we're going to create. So that was the first step of everything. Moving on now, the scenario of the whole thing was pandemic flu begins in Southeast Asia and ultimately ends up in Southeast Idaho. You know, one of the things we don't always think about is that there's a lot of businesses here in Pocatello and Southeast Idaho that have direct connection to Southeast Asia. I get them mixed up a lot. Southeast Asia and Europe. International companies, INL also flies around. People come from those countries to INL. It's not impossible that pandemic flu would start in Southeast Idaho. If it started in Southeast Asia, it could easily come to Pocatello in Southeast Idaho first, and then spread to the rest of the U.S. from here. But generally speaking, it starts on the coasts.
The borders.
On the 29th of July, in the exercise, the Department of Health and Welfare declared a pandemic, and then Southeast Idaho, Southeastern District Health Department recommended to all the different counties to open up their alternate care sites. So that's what we did in the exercise. If you go to the blog, I'll have the address here in a bit. It takes you through the whole scenario from the beginning, and it also talks about preparedness, and it has the videos in there that will really are a great learning tool for what pandemic flu is all about. Oh, I forgot to change that slide forward. Some of the players in the exercise, and they're called players, although they're really workers, but Ken Fagnett was in the exercise. He's the Idaho Bureau of Homeland Security Area Field Officer, and he works with the county emergency managers and county commissioners. We had our Health District Emergency Operations Center, that's about 30 people up there. The county emergency operations centers and their alternate care sites. Ultimately, that was about 150 or 200 staff from various county staffs and hospital staffs. And finally, another highlight of this was that we had the ham radio operators. Probably 50 or 60 ham radio operators called in and checked in on network, and a lot of them from the Bannock American Amateur Radio League. And
they like to practice their skills.
They talk a lot on the radio.
Radio operators.
That's awesome.
So that was great.
Because when all the communications go down because everybody's sick and can't go out and fix the cell phone towers, that's how we're going to get around.
Yep.
So we talked about who, now let's talk about where. And this is a list of the different areas we had where Bannock County on July 25th went to re-gym at ISU, and that one was scheduled early because they were redoing the floors. Every year you try to get a gymnasium for something.
And they're redoing.
They got to redo the floors, so it happens every time. Bear Lake County down in Montpelier was at the elementary school. Butte County and Oneida County we ended up rescheduling. Things got really, really busy down there with various events. In Preston, for Franklin County, they did it at the Oakwood School. Fort Halls is at the Early Learning Center. And